There's side effects that are possible with a robotic prostatectomy procedure. Your urinary control is one of the side effects. If you lose your continence, that's a possible risk of the surgery. Of course, we're going to take steps to minimize that risk. And if you do suffer from it, there's things we can do to take care of it. Your sexual function is also at risk with surgery. Again, there's many factors that are involved with really understanding how much of a risk that's going to be. And there are things we can do to try to take care of that as well. And that's something we can talk about more as well. Your reconstruction of the bladder and urinary tube. In that area, sometimes there can be what we call a bladder neck contracture. In my hands, that occurs perhaps less than 1% of the time, and it can be fixed as well. During the case, if we have to remove your lymph nodes, the lymph nodes, sometimes a side effect from removal of the lymph nodes is forming what we call a lymphocele, which is a collection of fluid that is accumulated where we had removed the lymph nodes. If that happens, sometimes it can get infected, and if it becomes infected, it becomes painful. And at that point, we'll have to have a radiologist, put a drain in to take care of the lymphocele. That usually happens about 6 weeks or so after the surgery. Again, it's in a small percentage of patients, and it's something that we can also take care of. Finally, there's a chance of a hernia at the incision sites. The risk of that is also low. Perhaps less than 5% of the time can someone get a hernia, and we can take care of that as well if that happens.